Hello again, everyone. My name is Marty Guthmiller. I'm CEO of Orange City Area Health System. And you'll notice also today, as our guest, Dr. Alan Laird is with us as well. This is the 24th edition of the COVID-19 community briefing. And so we've kind of fallen into a bit of a routine with this. So I'm going to continue that, and then we'll have Dr. Laird share a couple things, and then I'll close it out as well. So again, the normal things that we talked about, first of all, today would be the scoreboard, our local scoreboard here at the health system. We have performed 261 tests, and as predicted, those numbers are going up because we're doing a lot of pre-surgical testing and OB testing, that kind of thing. But actually what's happening, and again, kind of as predicted, our positive rate is going down. And so we've had 21 positives out of the 261, which is an 8.0% rate. That rate had been 8.5 below, but that compares to a much lower rate at the state level, and I'll share this again later. The state rate is 12.4%, and our county rate is 20.2%. So at 8.0, our rate is very good, actually, and what is kind of expected. A couple things I want to point out again is, if you want more detail, go to a couple websites, particular one, coronavirus.iowa.gov is all kinds of stuff that you can get on there. I'm giving you the Reader's Digest version, but you could go there. If you're interested in testing, please go to testiowa.com. And contrary, I'm going to skip around a little bit, but contrary to what the website might say, even though it's a good website, the testing will be in Sioux County through Friday of June 12th. I think the testiowa.com site might say something sooner than that, but we've been told that it is through Friday, June 12th. So if you'd like to take advantage of that, please feel free to do so. At the county level then, we continue to see some more cases as well. We have now tested 1 out of every 25 Sioux County residents. That's 1,395 tests, 282 positives, and as I mentioned before, that is 20.2% positive rate. At the same time, then we branch off into hospitalizations, in other words, kind of as one measure of the severity of those positives. And the number of hospitalizations in Iowa as a total is 334. Not much different than the last time we talked at 336. But I think what's more important to us, of course, is what's happening right around us. In Sioux County, we currently have 0 hospitalized patients with COVID-19. O'Brien County is 0. Lyon County is 0. Plymouth County has gone from 5 to 4, and so they've dropped a little bit. Woodbury County continues to drop. They were at 46, are now at 44. And Polk County has jumped up a little bit. They went above the 100 mark. They're at 104. And BV County, Buena Vista, as we mentioned, is kind of a hot spot lately. They stayed constant at 14 from the last time we've talked. So again, not dramatic increases in that. I want to talk then about Region 3 specifically. Region 3, again, as a reminder, 20 counties in northwest Iowa. There are 97 currently hospitalized in Region 3 in those 20 counties. That number before was 90 when we last talked, so that has ticked up just a little bit. There were 8 patients admitted in the last 24 hours. That number was 5 the last time we visited, so again, a little bit of a tick up there. 45 in the ICU, and as things go, that's a little better than the last time we talked at 46. But basically things kind of steady in Region 3. One level up, and then this is it for today at the state level, is 19,688 positives. As I mentioned before, that is a 12.4 positive rate, 12.4%. And so that number is trending down again as we test more people, 1 out of 20 now in the state of Iowa. My math degree lets me calculate that at 5%. And so we're now tested 5% of Iowans and 12.4% rate. Our guess is as that number goes up, as the testing goes up, that percentage is going to come back down a little bit. That's what has been shown anyway. I want to shift gears now a little bit, and what we try to do with these briefings is, as issues come up, as we hear about things in our community, as questions are raised, we want to try to address them in this format, as oftentimes it's certainly easier, potentially easier, but also has the opportunity to be clearer, and that the ambiguity of an email or a social media post, we want to talk through the issue. And so I've asked Dr. Laird today to talk to us about testing, and I think specifically pre-surgical testing. And so I'll turn it over to him and take it from there.
So we are trying to take those appropriate steps back to normalcy as is dictated by the situation and guidance from the state and our other health partners. And one of those is beginning to do more elective procedures and surgeries. And so, of course, we want to do those on people that are healthy. And part of that is also trying to determine the people who may be sick and not know it with COVID-19, in addition to those who are sick. So we have two prongs to this approach to try to evaluate that. One is a questionnaire that we will ask anybody coming in for a procedure or a surgery that's elective. And we'll ask that on ideally three different times or three different events. One is about a week prior, when they're seen for an evaluation for fitness for surgery and or have a conversation with their doctor about doing the procedure. The second one then will be when they receive a call from same-day surgery for preoperative teaching and going through the things they may need to do for their surgery. And then again, on the day that they come in, we will ask them questions trying to discern if there's a change in their health that would throw up a red flag that says, hey, maybe something's going on, we shouldn't proceed with this. In addition to this, we are doing testing for COVID-19 to try to detect those people that maybe are sick and have it and don't have symptoms yet, or as much has been talked about with the asymptomatic person who's a carrier of the disease. And the reason we're testing is both for that patient or that person, because we don't want to do a surgery on them if they're sick or about to get sick, if we can prevent that, as well as for our staff, that they're not exposed and have a surprise exposure, or for those patients that might follow them into the surgery suite or use the same machine. So we're trying to make sure that we do the testing, and after we get the testing, we're asking people to please isolate at home, don't do a lot of traveling, don't go a lot of places, because we don't want you to pick something up in the meantime. And so those instructions will come to them from their physicians that are involved in their case, as well as from the nurses that are involved as well. And right now we are testing everybody, young, old, men, women, everyone, because we don't know who may be an asymptomatic carrier or about to get the disease. There has been some areas tossed around, should we be testing children, but we have felt that that's necessary because kids, while they've been fortunate for the most part to not get severe COVID disease, they are very good at making viruses. And that's one of the reasons the schools closed, was because kids are very good at manufacturing virus. They are very good at spreading it between themselves. And so we feel right now, as we reopen to be safe, we need to test all age groups at this time to try to make sure we're not putting any person at risk or anybody else at risk that's caring for that person or will follow that person into surgery. So I know it's not fun. I know it's one more thing that's already in a complicated process, but we really, really appreciate people complying with that and understanding and giving us and each other grace during this time as we seek our way forward in reopening.
Oh, thank you, Dr. Laird. And I hadn't intended to go there, but I'm actually having my first test tomorrow because I have a procedure, too much information, but I have a procedure on Friday. And so I'm going to have my first COVID-19 test tomorrow. And so
I'll ask if I can do it.
No, thank you. Okay, so what I want to do now is pivot just a little bit into some clarification, a couple points that Community Health Partners, our public health arm, asked us to communicate. One of the things that is kind of confusing out there is what actually is a contact. How is that defined? And IDPH, the Iowa Department of Public Health, did clarify that a contact is defined as being less than 6 feet away from someone. And I think most of us get that part. But the second part is for more than 15 minutes without mask protection. So a contact with someone is actually unmasked for more than 15 minutes within 6 feet. If you are beyond 6 feet, less than 15 minutes, masking is a little bit of a question whether you want to do that or not. But again, the social distancing, 6 feet or less for more than 15 minutes is considered a contact. So again, that's just passed along from public health. This is also another important thing, and unfortunately in today's world, people take advantage of everything. But public health wanted us to pass along to assure you that all tests, whether at Test Iowa or through IDPH, are followed up by either public health, our local public health, or by the Iowa Department of Public Health itself. Please answer your phone when they do call, but please, this is the important part. They will never, either IDPH or CHP, will never ask for your social security number. If you are asked for your social security number on a call saying to follow up on a test, on a COVID-19 test, do not give it. Hang up, say thank you very much and goodbye, but do not give your social security number. It is a scam. I was not aware of that, but apparently public health is, and apparently that is going on. So IDPH and CHP will never ask for your social security number as a follow-up to a COVID-19 test. Please remember that. We are continuing to expect guidelines this week on long-term care on our nursing home. There's also some child care guidance coming out as well. We want to open up nursing homes as quickly as we can, and we will do that under proper guidance from the state and under proper guidance from our local medical personnel as well. And so we will do that as soon as we're able, and we watch that stuff all the time. So please keep that in mind also. Just also a reminder, maybe Dr. Laird wants to chime in with this as well, is to keep health maintenance stuff up for yourselves and your children. We don't want the negative health outcomes to be greater for you than COVID-19 itself, because you are foregoing testing of various kinds, including I'm hearing children's immunizations are being foregone because of fear of coming in. Would you like to comment a little bit?
I would love to. And first, let me take the vaccine thing. I really do want to encourage people. Like I said, the worst case scenario is that we have an outbreak of measles or other severe childhood disease because we did not get people immunized during COVID-19, and that would have far more harm to children than what COVID-19 has had. So we do want to encourage you. We really believe that we have worked hard to have a safe and secure way that you can come in and get those things done and performed. And even as we get back to more normal things, we continue to work hard to keep those things safe and available. So we do want to encourage folks about that. The other comment I'd like to make that chimes into this is in the newsfeed, they talked about the dramatic drop that they've seen in the diagnosis of new cancers over the last 2 months. Well, cancer hasn't gone away. And it's not because, oh, hooray, new therapies have changed the initiation of cancer. It's because we're not finding them. And then those things tend to be time bombs. So we would encourage you for those health maintenance issues, such as mammograms and colonoscopies and those things. Again, we're trying to, as we talked about earlier, open up in a safe manner so that those things can be found early when they're in a curable stage, so that we don't have somebody who moves from a curable cancer to an incurable cancer, or one that can only receive treatment because we were closed down or because of COVID-19 fear. So we want to encourage people on those health maintenance, both for your children and for yourselves.
Thank you. We're here, we're safe, we're ready to serve. So come on back. On that note, we did transition today, and you'll see some postings here and there, transition back to our quote unquote regular clinic. And we have an acute area in our clinic. We have other non-acute side of our clinic as well. That's all being done today, but it's back in the main area. And the so-called well clinic will transition over to our regular clinic beginning today. When you're calling for an appointment or a schedule, people will direct you accordingly. So that takes effect today. So as we close, I just want to remind you to keep controlling what you can control. It's a crazy world out there, even more so over the weekend now, non-COVID. Again, things happen besides COVID in the world, and we have to be willing to kind of stay on top of all those issues as well. So continue to control what you can control, lose some weight, manage those blood pressures, manage that diabetes, those blood sugars, and take care of yourself. Stay vigilant, stay strong, and stay healthy. Thank you very much for joining us today.